You know, one of the most important things that we can do in our lives is to take care of ourselves, to take care of our health. And with us today, we have some ladies that are going to talk about women's heart health. With us today, we have Dr. Joy Jackson, and we also have Dr. Anita Arnold. Ladies, thank you for coming on today.
Thank you.
Thank you.
Now, you know, February is a special month concerning National Heart Health. Tell us a little bit about February.
Okay. February 1st is National Go Red for Women Day, and this is a designation from the American Heart Association and the American Heart, Blood, and Lung Institute. Created this about 10 years ago in an effort to increase awareness of women in our country of the risk of heart disease. If you ask most women, they will say that their biggest risk to their health is cancer. Interestingly, heart disease is the number one killer of women. And 1 out of 3 women will die from heart disease, but 1 out of 5 will die from cancer.
Wow. So heart disease is a really serious disease that we're talking about here.
Yes, it is.
When we talk about heart disease in women, what are some of the major risk factors that are involved with this?
I think that's one of the things that's become very important for us as physicians. Both Joy and I work with a lot of women, and the idea is for them to understand the risk factors that they have and be able to empower them to do something about it, just like you were talking about earlier. For women, similar to men, diabetes, the pre-diabetic or metabolic syndrome, some people call it, is really important. Obesity, sedentary lifestyle, high blood pressure or hypertension, high cholesterol. If you have a family history of coronary disease, someone who's died early of heart attack or stroke, that's really important. If you have peripheral vascular disease, that puts you at a higher risk. Certainly smoking, all of those issues. Specific to women, however, is early menopause, taking hormone replacement therapy, which in the past we thought might be protective for coronary disease. As it turns out, it is not. It is a risk factor, although there are some women who need to take it, so we're not telling people to stop their medicine. If you have certain diseases while you're pregnant, for example, if you have diabetes that you got when you were pregnant or high blood pressure, again, later on in life, that puts you at higher risk for the development of coronary disease. If you're a young woman taking birth control pills, and especially if you're a young woman who smokes, very high risk for the development of heart disease and or stroke. We kind of lump them together since it's a vascular problem.
Wow. Now these are just, what we're talking about is just risk factors, so it doesn't necessarily mean that you will get heart disease, but these are the things that if you fall into those categories,
you're
really
more likely to get them. For example, if you have diabetes, 30% of my patient population, which consists of all heart patients, have diabetes. So it just puts you at a much higher risk. And then, of course, if you start adding the risk factors, if you have multiple risk factors, it puts you at just much higher risk. We need to understand that 50% of our population, men and women, have this problem, and it's much more prevalent in certain groups of people, and so that's why we want people to be aware of their risk factors.
I think it's probably important that people recognize that they fall into these risk categories so that they can be so that they can look ahead rather than waiting for a heart event to happen.
Well, exactly, and that's why we talk about primary prevention and having a primary care physician, and I think that's really important too.
What are your recommendations as far as, let's say somebody falls into these heart risk categories or factors? What is your recommendation as far as getting checked up and keeping up to date with those examinations?
Right.
Do you want me to take that? I think it's important that women maintain a relationship with a physician as a primary care provider. Being a woman myself with children, having had children, I think we find once, young women will tend to go to the doctor for family planning, for pregnancies, and then once the children are born, their focus tends to go to their families and less to themselves. So there's about a 10 or 15 or sometimes 20-year lag between the end of childbearing and when they hit menopause. A lot of women don't really seek regular health care during that time, and that's when the risk factors really develop and become important. A lot of us tend to gain weight, If there's going to be a tendency toward diabetes or hypertension, it's going to occur usually late 30s to early 50s. An interesting statistic is about over 50% of women after the age of 45 have some degree of hypertension. And so that is a really prime time to have a relationship with a physician to discuss risk factors and try to ameliorate them.
Very good. Now, once you've understand the risk factors and everything, and with having heart disease as such a high occurrency, what are some of the symptoms that people should be looking out for that would signal, possible heart disease?
Right. Well, you can divide heart disease into a number of things, one of which is stroke, one of which is heart attack. And so we're really aggressive in letting people know the risk factors as well as the presentation for both. Specifically looking at heart disease, if we're talking about a heart attack, I give a lot of lectures and I tell people that people our age recall the Fred Sanford, I'm coming to get you, Elizabeth, and he's grabbing his chest. Very common in a man. They have chest discomfort that's overwhelming. Women will get chest pain, but it's not quite the same thing. It's more epigastric, like it feels like a bad stomach ache, or they get a very short of breath out of proportion to the activities that they're doing. For example, they could go up the stairs, now they're going up the stairs, but they're huffing and puffing, and they feel a little pressure. Perhaps because of childbearing, women don't use the word pain as much. Where a guy will say, I had chest pain, a woman will say, I had chest pressure. So if you as a physician ask, did you have chest pain, they'll say no. So shortness of breath, bilateral arm pain, jaw pain.
Now, when you say about bilateral arm pain, are you talking like a soreness or a tightness or like a tingling? Like what's...
More people describe a soreness, or it's too tight, or chest discomfort like the bra's too tight. It's just a feeling that's not quite right, but yet it's not overwhelmingly painful for them, if you know what I mean. So I think those are very important, as well as overwhelming fatigue. And I hesitate to say that because, women do double duty. They home and work, and so fatigue is an issue, as is stress. But I'm talking about fatigue out of proportion. You just feel awful. You just feel like something's not quite right. And I always tell women, try and be cognizant of your own situation. And so if you've never felt this before and you're really uncomfortable, just go ahead and seek medical attention, because you could be having a heart attack and really not know it. I distinctly remember one patient, I said, well, I'm sorry, but you had a heart attack and this is what we need to do. And she was adamant she did not have a heart attack. Absolutely not. I feel some discomfort, but not like what I should be for a heart attack. So we tell people, don't always look at the television set, and know your own limitations and what's bothering you.
Well, I think it's interesting that you pointed out the Sanford illustration and what has been promoted as a heart event. The symptoms, and it may be more tailored toward a man than a woman. So to understand that, it may not be this terrible, awful pain, but it might just be an abnormal discomfort.
Right.
And
exactly.
And I thought your advice to give, if it doesn't feel normal, get it checked out. Don't let it go.
Because people always say, I don't want to go to the emergency room. It's going to take 8 hours out of my day, and I'll be there forever. But you know what? It's really easy. They do an EKG, they can do some blood work, and they can immediately tell you whether or not you're having a heart attack. Better safe than sorry.
Yeah, absolutely. What can women do to reduce their risk of having heart disease?
Well, I think the most important thing is to have a primary care physician. And Dr. Jackson mentioned it. There's a huge time delay between end of childbearing till the early menopause, mid-menopause years. And if we lose 15 years of treating diabetes, that's a big problem overall. Absolutely. So I think maintaining that relationship with your primary care physician, and then knowing your risk factors. You need to know, are you a diabetic? If you're a diabetic, are you controlled? If you have high blood pressure, are your numbers good? If you have high cholesterol, are your numbers where they're supposed to be? And we encourage that dialogue with your physician. Also, you need to maintain appropriate weight, try and exercise. It doesn't mean you have to be, a weekend warrior, but even just walking 30 minutes a day is really helpful. We encourage everyone, including teenagers, to eat healthier. This classic American diet is really not the best thing for us. We know that. So control what you can control. And if you have all of those things fairly well controlled, you're going to be doing very well.
Yeah. And I think, as is with most health issues, education is a key factor. Knowing knowing what to look for, how to adapt your diet. Doctor, can you just kind of talk to us a little bit about how women can maybe inform themselves and educate themselves, empower themselves to fight against heart disease?
Sure. I mean, I think the first place to go is your physician, and there are also a number of resources available on the internet. The Women's Heart Foundation has an online survey tool that a woman can pull up and actually assess her own risk, and then can print it and take it to her provider. And I think every woman needs to know what her cholesterol is, every woman needs to know what her blood pressure is, and what the goals are. So that's a good talking point to have with a provider. And to, again, a woman needs to put her health first. She won't be there to take care of her family if she doesn't think of herself first.
Absolutely. I kind of think of the illustration when you're flying and you open up that little pamphlet and they say about, make sure you put your mask on first and then tend to your children, because if you don't take care of yourself first, you're not going to be able to take care of your children.
Absolutely. Very good example.
Just to recap, the website that you were talking about to get the quiz, you had mentioned that to me earlier, found at womensheart.org.
Correct.
And you'll just go on and click on the Women's Heart survey.
Right.
Okay.
And we will also put a link on the Polk County Health Department website, which is www.mypolkhealth.org. So you can go either way.
Okay. Terrific. Ladies, thank you so much for coming on and informing everyone about such a tremendous need here to educate the public in knowing how to take care of women's heart health. And you look terrific in your red. You look terrific in your red.
Thank you very much.
Thanks for coming on.
Thanks.
It's Women's Heart Health. February is a big month for women's heart health. It's important that we make sure that we're taking care of ourselves, and that goes for men and women alike. Inform yourself, educate yourself, go online and find out information. It's your best defense against getting sick, and your best opportunity to stay healthy. See your doctor. Don't let things go. If you need more information, you can contact the health department at mypolkhealth.org, and they will be able to help you in any way that you need help. You can also go on to take that simple quiz at womensheart.org